In relapsed and refractory follicular lymphoma, we've had a number of our dose cohorts that had 100% response rate with a 100% complete remission rate. If we look at all of our follicular patients above 5 milligram dose level, we see in total a 95% overall response rate with a complete remission rate of 77%. So it's a very active regimen. We, with relatively short follow-up of just over 6.5 months, I think, we looked at the progression-free survival, and the median progression-free survival in that follicular lymphoma group was about 11.5 months, which is, I think, a reasonable PFS in this, again, heavily pretreated population. In terms of the other large group of patients that we saw, diffuse large B-cell lymphoma, we saw a clear dose response. So as we went up higher in doses, we had higher response rates. So once we were above an active dose of about 80 milligrams and some higher dose levels in the large cell lymphoma patients, we saw excuse me, let me backtrack. Then we looked at them in terms of patients who had had prior CAR T therapy and patients who had not had prior CAR T therapy. And in the patients who had not had prior CAR T therapy, our overall response rate was 71%, and all of those responses were complete remissions. In the patients who had had prior CAR T therapy, our overall response rate was 50%, and half of those patients, 25%, had complete remissions. So we were, thought we have a pretty favorable signal. This study was not limited to follicular lymphoma or to large cell lymphoma. It included any CD20 positive B-cell lymphoma, so we had some other diagnoses. And the ones that we had a couple of patients of were mantle cell lymphoma and marginal zone lymphoma. And in both of those lymphomas, we saw a overall response rate of 67%, so about 2/3 of the patients, and a complete remission rate of 33%, so about half the responders had CRs.